Welcome back to This Week in Global Health. This Week in Global Health is a weekly live global health news roundup. This week, we're doing something a little different. We're going to be interviewing one of our very own panel members. If you've been watching This Week in Global Health or TWiGH, you will have seen Sulzhan Bali on the show every week. She's one of our science gurus. She's a genius of note. She's a public health aficionado and a lovely person, and more. Okay, I have to stop myself there because I carry on all day. Sulzhan recently went to Nigeria and she did some really interesting work, and so we're just going to spend a little bit of time quizzing her, finding out what she did, where she went, what she learned, etc., etc. So now, Terry, who you would have seen on the show many times before as well, Terry has some students that have put together a little video which we're going to have a link to. The link will be, okay, if you look where my hand is now, I'm going to stick an annotation just above my hand. If you're watching this on YouTube, you can click on that annotation. It'll take you straight to the video, and you can watch it. We're also going to have a link to the video in the description below the video on YouTube. So if you're watching on YouTube, you can click on that link. Terry, could you quickly tell us a little bit about the video that the students put together?
Of course, Greg. So first of all, hi from Southern California. I will tell you this link Greg is going to put up is some undergraduate research students I have the privilege of working with. And I asked them to put together a 1-minute video on Nigeria as we introduce this subject with Sulzhan.
Okay, thanks very much, Terry. And what I didn't do, which I meant to do, was introduce the panel, all right? So obviously there's myself, Greg Martin, we've got Terry who's just spoken, Sulzhan, who's the focus of our discussion. So I'm not going to introduce her because you all know her, but who you may not have met before is Marie. Marie, would you please say hello and introduce yourself briefly?
Hi, everyone. It's nice to be on the show for the first time. I look forward to having the conversation with Sulzhan. I've been working with TWiGH as the blog editor so far, and this is my first foray into being on the live show.
Yeah, I was actually going to say, you haven't seen her here before, but in fact, she has been very active on the back end and making sure that the blog works and editing the blog. She's actually been a superhero of note. So thanks very much for all of that hard work, and great to have you on the show with us as a panel member tonight. Right, we're going to jump right in with some questions, and I'm going to start off with a question to Sulzhan. Sulzhan, can you tell us a little bit about the program that you worked on? What were you doing in Nigeria?
Definitely, Greg. So I was in Nigeria looking at the impact of the Ebola outbreak on private sector in Nigeria, and also what kind of challenges the private sector faced and how they helped and cooperated with the government in facing those challenges. So private sector played a major role in containing the Ebola outbreak in Nigeria. So I was looking at how they did that. And if you haven't noticed, but by the way, talking about Nigeria, I'm actually wearing a dress that I got from Nigeria. It is a typical Nigerian print, and it's a Yoruba dress. Yeah, so had a great time there.
Looks terrific.
Thank you.
Terry, you had a question, and you're on mute.
There, I'm off.
You're back.
So
You're back.
for sure, Greg. Sulzhan, you know, the West Africa Ebola issue was so crescendoed, and particularly with Liberia and Sierra Leone. Here's my question. How do the Nigerian people feel about that? How were they responding? Did they change the way they have their everyday schedules because of what was going on?
Oh, it's a great question, Terry. Definitely. I mean, since you mentioned Ebola, I would like to also tell viewers here that Guinea, the last Ebola-affected country, recently released 68 of the last Ebola quarantined people yesterday from the quarantine. So we're winning this fight. In Nigeria, we saw a very interesting phenomenon called aversion behavior, something I like to call fearonomics. Basically, what happened was because once the Ebola came in, the first incident came in, people's habits started changing. People wanted to protect themselves at all cost. And this manifested in trying to avoid in any way they can get the disease. For some people, it meant maybe buying 2 tickets on the bus so they don't sit next to someone. For some people, it meant stop eating suya or street food, actually a very delicious kebab from Nigeria made of chicken and beef. And for some people, it meant not going out. So yes, it definitely changed people's behavior in a very drastic manner at that time.
That is very interesting. One thing I was wondering is how did you hear about this opportunity, and did you have any specific sponsors that sponsored your trip or helped you on the ground?
Oh, that's also a really good question. When you're going for fieldwork, you need funds and you need a good mentor. I was very lucky that my university and my Duke Global Health Institute funded a large part of my field trip. So they provided me funds for transport, for staying, and I also was very lucky that I had two very good mentors who kind of helped me build contacts in Nigeria. I work with Dr. Muhammad Ali Pate, who was the former Nigerian Minister of State for Health. And through him, I met my host organization. One of them was Private Sector Health Alliance of Nigeria, which is a public-private partnership to mobilize corporate community as well as private sector for a multi-sectoral coalition for improving health in Nigeria. So they were my on-field partner who also funded my in Nigeria transport. They provided me with office and facilities to like a desk or internet and paper. And I also work with Ebola Alert, which was my other partner in the field, in just kind of recruiting volunteers to help me and recruiting my research assistant who has been instrumental in transcribing my interviews as well with me. So, yeah.
Sulzhan. Now, I happen to know where you're from, but what I want you to do is tell people where you're from and a little bit about your culture. And what I want you to also tell us about is, did you face any cultural challenges? Was there a cultural shock when you got to Nigeria? Was it the sense of, well, this is all completely different and, oh my God, where am I? And I can't speak the language. Or just tell us about the human experience of going into a place that was very different to something that you may have been familiar with and where you've come from.
Definitely, Greg. So I'm originally from India, and to be very honest, I was a little scared sitting on the plane going to Lagos. And the reason was because prior to going to Lagos, almost everyone I spoke to talked about how unsafe it is. Everybody had a story where they had read in the newspaper or someone warning me about Boko Haram. Somebody knew someone who knew someone in Lagos who had a bad experience. I spoke to people who actually did have bad experience or were evacuated. So I went in actually quite scared about what to expect. And the biggest culture shock that I got when I landed in Lagos is how amazing a country Nigeria is and how awesome the people are. People are very friendly. You will always have bad apples everywhere. But my experience in Nigeria was that having traveled more than 20 countries, I can say they're the warmest people I've met. So that was a shock. The other shock was obviously walking and somebody being addressed as auntie, which in my culture in India, you call people who are really old as uncle or auntie. And the person calling me auntie had white hair, so I didn't quite understand that. And speaking to my people who I knew, Nigerian people, local people, I realized that's a mark of respect, actually. So not something to feel offended about age.
That's really great. And it's actually funny you say this because I'm from Nigeria, and so a lot of that conversation is always interesting to see how things are portrayed in the news and the way that you experience it, which leads me to my next question about what challenges did you face with daily living? I know growing up there were always some interesting environmental conditions that I think could affect how your experience was.
Definitely. There were challenges. I mean, as in any developing country, there will be a few challenges. The challenges I faced daily was water. Definitely the water, unlike here in the United States where you can just open the tap and drink water, there you needed to buy bottles of water and bottles of water. So to go and get, and if you ran out, you had no choice but to go and get more bottles of water. So that was definitely something that put things in perspective of the challenge of potable water being there. Electricity was often a challenge. They did not have regular electricity, but you had diesel. So I almost felt that a large part of the economy was working on diesel, which was a little bit of a culture shock. The other, not a challenge, but a most fascinating thing that I found about Nigeria was everybody, despite the challenges they face in their daily lives, everybody had a spirit of, hustling. Everybody wanted to make something of their own. Really hardworking people. They had a safe job and they had a side job. So it's actually not very surprising. Greg, do you realize which is the country that has the maximum number of women entrepreneurs in the world?
I'm going to guess the answer is Nigeria.
It is. So, people are really hardworking, and, everybody has a hustle and a safe job. But having said that, being a woman in Nigeria was also, I could see there are challenges being that the reason you have so many women entrepreneurs in Nigeria is also because opportunities in the formal sector for women are limited. And Nigeria, unfortunately, also ranks among the top 20 countries, worst countries for women to be entrepreneurs in. So, there is definitely a balance that needs to be achieved between the ambition and will to develop, and as well as making conditions for entrepreneurs and for women in general better in the country.
So along that same line, you're talking about the locals. Give me the balance. Did you work with expats more than locals, or did you work with locals more than expats equally?
So I had a lot of local friends actually in Nigeria, and I feel when you go out in the field, it's really important to immerse yourself and understand the culture. And you cannot do that unless you interact with locals. So some of my closest friends that I made from the time in Nigeria were locals. My host organization was local. I got to meet a lot of people through there. The girl, Ajoke, so big shout out to her. She's my research assistant in the project. Definitely someone from the local area. The people I conducted my surveys with and trained to conduct surveys, again, local people, and really they were really excited about it. It was a wonderful opportunity for them and for me to learn from them about the culture more. So I actually interacted a lot with locals.
That's very interesting, Sulzhan. Now, tell us a little bit about how you prepared for this. What did you do in the build-up to the trip, and did all of that preparation pay off?
Wow, yeah. So preparing for fieldwork is usually a really big part of doing fieldwork that involves understanding the local partners. I got in touch with my partners, Private Sector Health Alliance of Nigeria, and Lawal Bakare from Ebola Alert, who played a major role in community mobilization during the time of Ebola. So I got in touch with them beforehand. I spoke to them, understood what things needed to be done. Within my friend circle, I tried to find out if I knew anyone from Nigeria, and that's how I actually ended up getting my accommodation through a friend of mine who was in the same university at Duke, whose cousin was married to someone who owned whose dad owned a guest house. So long chain there, but they became really good friends, and I stayed there. So definitely networking, very important. Reading books. I read books on Nigeria. I definitely saw documentaries, movies on Nigeria. That was very helpful too. And try to pick up a few Yoruba words like bauni, which means how do you do, or movapa, which means I'm fine.
That's awesome. So now that you've been there, and it sounds like you actually did a lot of preparation watching the movies and all that, would you have done anything different in your preparation?
Actually, that's a very good question. I think the only thing different I would have done is maybe not gone with stereotypes in my mind. I'm very embarrassed to say that getting off the plane, I was really scared. What to expect. I didn't feel like, because all I heard about Nigeria was scams, 401, Boko Haram, and polio. So, going there, I was really scared, but it would have definitely helped more if I did not have those fears or stereotypes in my mind beforehand, because it blew my mind away how wrong those stereotypes are, especially concerning Nigerians.
Sulzhan, I've got a quick question about communication, and I'm gonna put this in. I'm gonna put two questions into one. While you were in Nigeria, did you find it difficult to keep in touch and in contact with everybody back home and your family, etc., etc.? And how did you do that? Could you phone them? Was it Skype? Was it email? Blah blah, texting. And now that you're back to life as normal, are you still in contact with the people that you met and the colleagues that you met in Nigeria, and how are you in contact with them? Could you just talk to us a little bit about that?
Definitely great question, Greg. So in Nigeria, I was in Lagos, which is a major city. So luckily for me, I did not have any technological challenges in being in touch. In fact, to be honest, I almost felt that I had better internet access in Lagos than here in North Carolina. Because I had a little dongle which allowed me to have internet. Even when I was in a cab or anywhere, like, walking on the road, I had internet all the time. Good quality one at that. So I feel being in touch was quite easy. After coming back, I missed Nigeria a lot. I missed my friends. I missed suya, great jollof rice. And I've been in touch, especially with like my really close friends that I made there. Even a mother-like figure, like one of the aunties I met there. She was actually my mom's age, wonderful human being, lawyer. And I've been in touch with them through phone. So yes, I've been in touch, and I feel it's a great experience going out in the field. You meet people who might become your lifelong friends, and it's an amazing experience.
Yeah, and I'm actually sure that you will be friends with those people for life, and your paths will cross again. And just reflecting back on what you said about being able to communicate with the rest of the world while you were in Nigeria. In fact, if I remember correctly, you were a panel member on one of the TWiGH shows from Nigeria, weren't you?
Yes.
Okay, so that just goes to show, mountains, rivers, fires, and dragons will not stop you.
Definitely 3 shows at that, actually. 3 shows on
fantastic.
TWiGH.
Now, Sulzhan, could you tell us a little bit about the work that you did there? Can you just walk us through what the contribution of that work will be to global health, the global health thinking, and global health programs?
Oh, I love that because I'm very passionate about this. I feel when an epidemic happens, policy plays a major role, and I've been looking at how governments can have policies that will engage private sector more in times of epidemics. So what I've been looking at is how private sector helped out in Nigeria and how private sector can play a role in controlling an epidemic. And I feel that's a really big topic of discussion because the maximum impact of a lot of epidemics you see is not only direct impact of deaths and productivity or people getting sick, it's also due to aversion behavior. People stopping travel, trade, trying, making even rational or irrational decisions to protect themselves at all costs, which has a huge impact on the economy. I mean, we've talked about SARS, $40 billion in 2003 were lost globally because of SARS. With Ebola, the numbers are still being crunched, but $1.6 billion, 12% of GDP of Sierra Leone, Liberia, and Guinea was lost because of the outbreak. So I'm trying to look at how private sector can play a role in controlling the economic impact, and not only that, how they can play a role in surveillance, in communication, in technology. So that's what I feel it will have a lot of impact.
That's great, and I have to agree with that. Just trying to round up now, what would you say from your personal experience, also thinking about this larger impact on global health, what were your major take-home messages from your journey in Nigeria and the work that you did?
Definitely. I have 4 quick points as take-home message. First of all, global health is about collaboration and coordination, and nothing in global health is possible without that. Without my cooperation of my host partners, nothing would have been possible. Secondly, when you go into field work, it's important to look beyond the stereotypes and the barriers and engage in the community, embrace the culture. That's really important in terms of getting a good experience. Thirdly, try local food. There's nothing like, I'm a big foodie, so I had a great time, eating amazing suya and jollof rice. And fourthly, make new friends and enjoy the experience. So,
I'm just laughing to myself because I've done quite a lot of work all over Africa, and I must tell you that I'm not the experimental brave eater that a lot of people are when they travel. And I've often been, been offered food, and I've sort of been a little bit nervous about what exactly am I eating at the moment. And I mean, coming from South Africa, I've landed up eating all sorts of strange things, and all I'm saying is I'm not quite as brave as everybody else. Anyways, I think that's all the questions from us, Sulzhan. Thanks very much. I think I was really excited about you going to Nigeria. I think you, as always, have done a great job of explaining what it is that you did, and you know, I'd love to talk to you more about this, and I'm sure we will. That's all for us tonight. I think we're gonna have a link to that video that you can watch. It's a 1-minute video about Nigeria, really interesting, created by TWiGH students. So well done to them. Thanks for watching. Come again, same time, same place next week. Until then, take care, don't do drugs, always do your best, don't ever change, and see you soon.